You touched on this in your lecture, but do you find that the mechanism of injury for concussion relates to the severity of symptom or even longer term persistent symptoms?
Yeah, that's such a great question. And it ends up being like, we still are in a little bit of a black box with that, because on the one hand, we would say yes. And on the other hand, not entirely. Like, we don't entirely understand how the mechanism of injury influences it. Certainly, we would say that there is a relationship between higher energy mechanisms of injury, where, obviously really high energy mechanisms of injury will give you, a moderate or severe TBI. But even within mild TBI and concussion, there are like a little bit, more significant, more severe ones and more mild ones, right? And so I think everybody can sort of understand that, being in a motor vehicle crash, mechanism of injury has a different energy than, if you had something that was an awkward header, and so I think we still don't understand the biomechanics behind that. And I'm lucky that I'm working with Christy Arbogast, who's a PhD bioengineer at CHOP, and we're looking at that in terms of some of those questions. But I think that there definitely is a relationship. It's just not a direct one-to-one, correlation in terms of the type of mechanism of injury and then the type of injury experience or recovery that you have.